For over 60 years, the Heart and Stroke Foundation of Canada has been dedicated to fighting heart disease and stroke. Their work has saved thousands of lives and improved the lives of millions of others. Over the last 6 decades, the death rate from heart disease and stroke has declined more than 75%, and chances are you know someone who's had their life touched by this incredible organization. So today, I've invited Donna Bedell, Community Fundraising Manager for the Heart and Stroke Halton, Hamilton, Niagara and Brantford Region, to tell us more. Donna, thank you so much for being here today.
Thanks so much for having me, Joshua. It's a pleasure. I'm happy to be here.
So, to start things off, tell us a little bit about what the Heart and Stroke Foundation of Canada does locally.
Sure. Well, first of all, here at the foundation, we like to say that heart and stroke has no fixed address. And by that, I mean that what we do at a national level really affects us all at the local level. You mentioned in your intro that we've reduced the death rate by heart disease and stroke by 75%, and that's true. But still, every 7 minutes in this country, someone dies from these diseases. So obviously, there's lots more still to be done. And a good example of the work that we've done, the stroke center that opened at the Brantford General Hospital in 2013 is a direct result of the research that the foundation did that led to this model of organized stroke care. This model has revolutionized stroke diagnosis, treatment, recovery, and positioned Canada as a leader in stroke research and stroke care worldwide. And Brantford is extremely lucky to have one of these centers located right there. Stroke patients that can be directed to the hospital, they receive the clot busting drug TPA, which again was pioneered by research done by the foundation, and this leads to much better outcome from stroke victims. Brantford has about 3,000 stroke victims every year, and now they've got a state-of-the-art place where they can go and be treated. The foundation has also placed 369 AEDs. So those are automatic external defibrillators in Brantford and the surrounding regions. And actually, just this week, the provincial government passed legislation that we have been advocating for to have AED registries that will be linked with and integrated with 911 services. I don't know if you're aware of this, but 9 out of 10 people that experience a cardiac arrest outside of a hospital setting will die. And so the number of if they can get immediate care through something like an AED or CPR, that greatly increases their chance of survival. So this registry that we've been advocating for is really important because now when people dial 911, they'll be directed to the nearest AED, and while on the phone, they'll be walked through how to use it, and it's going to have an immediate effect on saving lives. So we're
So
very happy about that.
it sounds like you're doing not only tremendous work on a national level, but right here locally in Brantford, you guys are just revolutionary.
Yeah, it's really been amazing. You know, in addition, we are very privileged to be able to get into schools through our Jump Rope for Heart program. And one of the key things, Joshua, that's so important to us is educating our young people on healthy habits, healthy eating, the fast signs of stroke. We are finding markers for heart disease and stroke in younger and younger people. And it really starts with education. And through the Jump Rope for Heart program, we're able to do that. In Brantford and the region, the surrounding region close to Brantford, we reach about 20,000 students each year through our Jump Rope for Heart assemblies. And, you know, we think sometimes kids aren't listening, but last year I met a family at a big bike event, and the mom, who was just 40 years old, had had a stroke. And it was her daughter who had recognized that her mom was having a stroke and called 911 to urge her father to call 911. He was able to say she was having a stroke. She was rushed to the stroke center and her life was saved, as a result of this. And it was as a direct result of, the education, the center, the drugs. So it really is all connected together, and we're really privileged to be able to deliver that message.
So I often end up going off script, but I feel
Sure,
like this is the
absolutely.
opportunity to go off a script if there was one. So the Heart and Stroke Foundation, it's research, it's marketing, it's events, it's community, it's actual frontline workers as well. It's not just an organized, like it seems it's so multifaceted.
Yeah, it really is. I would say, I didn't realize, and I'm still learning. Like, to be honest with you, I mean, I think one of the things that I've learned so much about the foundation in recent years. I've had more exposure to the mission side of things, right? So I'm on the fundraising side. So my job is to go out and raise money so that we can fulfill our mission. But as I've learned more about what that mission is, I've really understood how connected and multifaceted it is. And it's something I didn't really understand. So, that example I just used, it starts with research. Everything goes back to the science. So the research then leads to education, which leads to advocacy, which then leads to system change. And I think where the Heart and Stroke makes the biggest impact is in these big system changes that then affect all Canadians. So Canada is really lucky because of the foundation, the federal government that funds a lot of research as well, and groups that we will partner with, like the Canadian Stroke Congress and heart organizations. Together, we work together to kind of really build these big system changes. So Canada is a world leader in stroke research and in the kind of care that we deliver. And it's because we have these centralized centers of care that we're able to optimize and do this. And so we're looked to around the world as a leader.
It's so
And I
great
think
to
that's so
hear
important. Yeah,
that
it
Canada
really
is
is.
a leader. So every great organization has a good starting story. So tell me, how did it all get started?
Well, really, it started with a group of passionate clinicians and physicians and researchers who saw a problem and wanted to solve it. So in 1952, a small group of people got together, and it was leaders in their field. I think there were cardiologists, physicians, and researchers who wanted to see what they could do to try and solve a problem. And I think it started quite small. It's morphed over the years. We've gone from having, there was the Heart Association, there was the Stroke Association, there were separate provincial organizations, and now we've come together under sort of one national umbrella, where we can really, I guess, optimize to deliver the best care and the best education and advocacy as a group. I mean, it started off with a vision, right, of lives sort of free from heart disease and stroke, and that mission and vision really hasn't changed. And I think that's what's kept us so strong and so focused over the years. I would also say um, we stay connected to that sort of medical and research community through our volunteer boards. So all of our board, our national board of governors, which is how we're governed, and our provincial boards are all volunteers who are passionate about the work that we do. And I think that's also been really important for our success going forward, because they really keep us focused on what are the needs, what are the things we need to really be focused on, and fulfilling the strategic plan. And I
So,
think that's really been important.
like I said in my intro, it's been over 60 years of continuous research, advocacy, and just it's continuing to grow.
Right, $1.55 billion so far has been put into research by the
And
foundation.
millions of lives touched.
Millions, absolutely. Yeah,
So the you know COVID-19 crisis has transformed the way a lot of organizations are operating right now. So how has
absolutely.
it impacted the Heart and Stroke Foundation?
Well, it's had a huge impact on us. I mean, to be frank, I mean, I suppose the biggest impact, the most immediate impact that we felt was the closing of our offices. It happened back in March. It's been like 75 days, like it has been for everybody.
Yeah.
And we know that our offices are going to remain closed till September. We've also, unfortunately, because we've taken a huge hit to our revenues, somewhere in the neighborhood of about 30%. We're still looking at what that looks like. We've had to lay off temporarily about 45% of our staff and really kind of optimize to get through this period. I would say what hasn't changed for us really is our commitment to the strategic plan and really trying to execute on our mission. I would also say, if anything, our mission team in particular has really reacted strongly to what's been happening with COVID-19, because it has an impact really from a heart disease and stroke perspective on the people that we serve. And they've been, not only have they been working on fulfilling our strategic plan going forward, but really on reacting to and studying the science on COVID-19 and how it affects people with heart disease and stroke. And we've been putting on almost I would say about every 10 days, webinars that are publicly available on our website, heartandstroke.ca, uh, where people can go on and find out about things like nutrition, heart medications, rehabilitation. What are some of the things I need to be focused on? And so there are a couple of things, if you don't mind, that I just like to get out there so
Yeah,
that people
please.
understand, because there's a lot of misinformation about heart, stroke, COVID-19, and we want to make sure that people understand certain things. So there's 6 things that I want to
Okay,
make sure I get across. So
let's hear them.
first is that heart attack, cardiac arrest, strokes, they are medical emergencies. So you need to call 911 and get yourself to a hospital if you're experiencing any symptoms. There's been a 30% reduction in people going to the emergency if they're experiencing these types of symptoms, and that is a problem because emergency rooms are equipped. They've got protocols in place. It is absolutely safe, but people are afraid because they're afraid they're going to get COVID-19.
But
I'll
if you
give you
see the signs of
a heart
heart
attack
and stroke,
or a stroke, or you
call
have a cardiac
911
arrest.
and go to the hospital.
Absolutely. My father had a cardiac event a few weeks ago. My mother did not hesitate. My father went through the emergency. He was admitted to the hospital. He was out in 2 days and he's back home and he's fine. But we called 911 because that's what we know we needed to do. So call 911.
So number
The
2,
Number 2, people with underlying medical conditions such as heart conditions, stroke, and the associated risk factors for heart disease and stroke are at risk of more serious complications for COVID-19 if they contract the virus. So it's more important than ever to follow public health guidelines and to make sure that we're observing social distancing, that we're washing our hands, that we're doing all of those things. Because if you do have a problem uh, with heart disease or stroke or those things associated with it, you could have more complications if you contract the virus. So it's just to make sure that you're staying safe. Thirdly, they have been reports that people should stop taking heart medications, that it's going to affect COVID-19. There is absolutely no scientific evidence to support that. So people should not change taking prescription medications as a result of COVID. If you want to make any changes, you shouldn't do it until you talk to a healthcare provider. The fourth thing is that preventing heart conditions and stroke and managing your health is more important than ever. So I know because I did it, eating those chips and going down that whole, what do they call it? The COVID-19.
I've
And they're not
said
referring to the virus.
I've done 3 things during the COVID-19 crisis. I have done Zoom meetings, I've eaten, and I have slept. That is a
Well, the
problem.
sleeping's really good. And eating healthily is good. But we want to make sure that people are still finding ways to get exercise and to do things safely in their homes. And for some people, safety looks different. So to make sure that you're exercising safely, and it's all we're recommending is 30 minutes a day, and you can break that down into 6 5-minute pieces, 3 10-minute pieces, do it all at once. It's fine.
So get exercise,
Eat
eat healthy, and
healthy,
take care of yourself
reduce
during.
stress,
Mhm.
get lots of sleep. So you're good on the sleeping part. That's
Yeah,
awesome.
I'm
You
not.
know?
No, I still don't get enough sleep. I'm gonna take care of myself better.
You absolutely should. The other thing that we want to mention is that physical distancing doesn't mean social isolation. Um,
Absolutely,
you
and that's
know,
so important.
It's so important. It's important for your mental health. It's important for your physical health. We also want to make sure that people understand that there's a lot of people suffering from diseases like ours that are elderly. They can't get their shopping done. They can't, um, sometimes get the interaction that they need. And it's really important to make sure that we're taking care of those people and that we're reaching out in meaningful ways. And we can do that in a socially distanced way. And I think
I,
it's important to understand that.
I'm sure many communities across the country have set up different neighbor helping neighbor programs through the power of social media and the internet. And, definitely make sure that you're checking in on your neighbors and your friends and your family members and everybody should be doing this during this time right now. Just there are some people, like you mentioned, who are having difficulty or who are sorry, compromised and can't get to the grocery store. And if we can help by picking up something when we are out getting groceries, right? Um,
Absolutely.
take care of one another, I think is the.
I think that's exactly it. And you know, that's a message that we really want to get across because it's so important. And it's important to check in, right? And it's important to know how people are doing. And the sixth thing is that rehabilitation, if you have had a stroke or a cardiac event and you have a rehabilitation program, you should really try and keep up with it and continue with it. And there are ways to do it socially distanced. There are ways to do it remotely. It's really being in touch with your healthcare provider and making sure that you're continuing along with that. And in fact, again, we have a really good webinar about that up on our website. And like I said, about every 10 days or so now, we're actually doing these hour-long webinars. They usually include somebody with lived experience who's talking about what they're going through, and then experts in particular areas, just to give out information about what people can do and dispel myths. So I
And I
highly
think
recommend them.
if you talk to your healthcare professional, they could probably recommend various different videos online that are exercises you could do at home that would be safe. I know there's a lot of videos online about workout routines. Maybe get advice from your doctor and find one that's
Absolutely.
good for you.
And any changes that you want to make to the protocols that you've been given, you should talk to your healthcare provider about.
But
100%.
definitely do something.
100%.
Don't let it
Yes.
fall by the wayside.
Yeah.
So, following this train of thought, the Heart and Stroke Foundation is a part of numerous events each year, whether it's an event that they're holding or an event that somebody's holding for them. And that's changed. So can
Yeah.
you talk a little bit about how if somebody wanted to support the Heart and Stroke Foundation right now, what is the best way? What is the best way for them to contribute or to make a difference in someone's life through the Heart
Sure.
and Stroke Foundation?
Well, I mean, you're right. Unfortunately, we've taken a hit to a lot of our events this year because they normally execute at this time of year, but we're trying to get creative. So there's a couple of things that people can do. So even though we can't run our events in person, we're trying something new this year. So for the first time ever, we're doing a virtual jump rope for heart. So if there are students and families that are listening to this and want to participate, you can go to the Jump Rope for Heart website and sign up, and it's hashtag virtual jump. It's what we're trying to get out there. The date is June 19th, and we're just encouraging people to be active. And there's all kinds of activities and healthy things that, like the easy healthy habits that you can get. We also have our virtual Ride for Heart. So normally the Ride for Heart takes place
Those are
in
those
early
big
June.
bikes, right?
Well, no, the big bikes are different.
Oh, okay,
Yeah,
sorry.
yeah. So Ride for Heart is where they shut down the Don Valley Parkway and the Gardner, and it's a 75-kilometer bike ride. It's a big event. But since you mentioned big bike,
Yeah?
we can't do that this year. So what
No.
we're trying to encourage is that the people that would normally have done big bike, and we have quite a few teams in Brantford, switch over and do the virtual Ride for Heart. So that's what we're asking people to do. And that would take place on June 7th or any time during the month of June. Other ways is simply to go to our heartandstroke.ca website and make a donation to donate to people that are participating. The other thing that you can do as well is if there is any kind of virtual fundraiser that you want to do, we have a program called My Own Fundraiser. And you can set up something and fundraise virtually. There's also platforms like Facebook Giving and others where you can, donate your day, your birthday, your anniversary, your wedding for a good cause. So,
Are
I mean,
all
I think,
donations done directly through the Heart and Stroke Foundation website, or is
yeah,
there a Canada Helps page or something
it,
like that?
they're all done through the www.heartandstroke.ca website. And for Ride for Heart, you can do rideforheart.ca, and Jump Rope for Heart is jumpropeforheart.ca. We really try to make it simple. Heartandstroke.ca, jumpropeforheart.ca,
Yeah. So
rideforheart.ca.
really help me hammer it home, because this is always my final question to all of my guests. Where do we go to donate? Where do we go to volunteer? And where do we go to learn more about the Heart and Stroke Foundation of Canada?
Well, we are very lucky because it's all in one place. It really is at the www.heartandstroke.ca website. Everything is there. You can volunteer through there. You can donate through there, and you can certainly learn more. And all of the COVID information is there. There are all kinds of resources, from recipes to exercises to, it's all there. It's a great resource. I cannot recommend it enough. It really is a great website.
So first and foremost, I want to say thank you for taking the time to share so much information about your organization. In research for this interview, I felt like I learned so much, but now actually having done the interview, I feel like I know so much more, and I hope that our viewers get excited about the work that you're doing, and that it leads to more people supporting the work that you and your team are doing. Thank you for
Well,
everything you do in our community. It's
thank
amazing.
you. And one last thing, though, that I would like to
Sure.
say, I just want to say thank you to you and to your community, because what I would say is the Heart and Stroke really is a volunteer driven organization, and we couldn't do what we do without the help of all those folks that support us. And I know in Brantford, we have so many people who knock on doors in February, who do their My Own fundraisers through Sioux Fest or the Brantford Curl for Stroke, who get on the big bike and ride for us. So I cannot say thank you enough to you and to your community, because you are huge supporters, and we are very, very grateful for that.
That's so fantastic. Thank you, Donna, for being here today, and I look forward to us connecting again soon.
Me too. Thanks, Joshua. You have an
Take,
awesome day.
you too. Take care.
Okay. Bye.